Good morning, future PTAs. Today we are going to talk about ultrasound and the use of ultrasound in physical therapy, what it does, indications, contraindications, and how it's used. So here is our outline. You can take a look at, see what we're covering today. What ultrasound is. Sound is a compression and rarefaction of waves. Compression is when material gets closer, particles within a material get closer together, and rarefaction is when they expand or are further apart. The ultrasound frequency in the ultrasounds that we use, the sound frequency is greater than 20 hertz. Typically, we use more so megahertz because it's so much greater. So that type of frequency is what we use for the therapeutic effect. The properties of ultrasound, sound waves enter the body and are attenuated by either absorption, that is when mechanical energy is converted into heat, so that causes a thermal effect. Reflection, which is when the ray goes and hits a surface and bounces back. And refraction, which is when it goes into a surface and changes direction, but still absorbs into the surface. Some of the properties of ultrasound. So sound waves are created by an alternating current being applied to a crystal with piezoelectric properties. Now, what that means, piezoelectric properties, is when something can generate electricity in response to mechanical force, or it can change its shape in response to an electrical current. So in this case, there is a crystal inside of the transducer head that changes its shape, so it expands and compresses, that compression and rarefaction, in response to an electrical current. So you give it a certain amount of electrical impulse and it expands and compresses based on that impulse. That's the property we use to create the effects of ultrasound. So the crystal expands and contracts with changing polarities of current, which produces the compression and rarefaction wave, which has therapeutic benefits. The sound waves travel deeper in tissues with lower attenuation than those with higher attenuation. So attenuation is loss of signal or strength as sound waves travel through a substance. So substances with lower attenuation lose less of their strength, and those with higher attenuation lose more of their strength as they travel through. So something like blood allows the sound waves to travel and does not lose the strength, versus once it is in bone, actually a lot of reflection happens at that bone interface, then a lot of the strength is lost. One thing just to note is the crystal within the ultrasound head is made from plumbum zirconium titanate. That's a good one. Plumbum zirconium titanate. That's the type of crystal we typically use based on its properties and how it conducts the current and creates that therapeutic effect that we desire. Okay, so here are some of the parameters, and we're going to go into each of these, but the intensity of the ultrasound is typically between 0.5 and 3 watts per centimeter squared. That's what we typically use for therapeutic range. The frequency is either 1 megahertz or 3 megahertz. And then the duty cycle is typically, sorry, got ahead of myself there. The duty cycle is either continuous, which is 100%, or it's pulse, which can be anywhere between typically 20 to 80%. Most ultrasound machines come with preset duty cycles, so you just pick between a few versus typing it in. So most of those are like 20, 50, 80% of the continuous cycle. The effective radiating area and beam non-uniformity ratio we'll cover in just a minute as well. So with the intensity, this measures the amount of energy per unit area. So the effective radiating area is the area of the transducer that transmits energy. So as you see in the picture, that some of the energy is more concentrated towards the middle of the transducer and less concentrated towards the outside, which is one of the many reasons that we have to move the ultrasound head continuously to kind of even out some of the heat and the other benefits of the treatment so that they're not more concentrated in an area, which could cause a hot spot or even a burn in the tissue and be less effective and be painful and cause damage to the tissue. The beam non-uniformity ratio of peak intensity to average intensity. So taking kind of an average between that peak intensity, the highest intensity, and the average intensity, and determining what the difference really is. So typically it should be between 2 to 1 or 8 to 1, and that will be listed on the side of the ultrasound machine. In order to be sold, it should be within therapeutic range and shouldn't have a greater beam non-uniformity ratio. The higher it is, the more likely there's going to be hot spots, the more likely it's going to be uncomfortable to patient, and that it could possibly cause some type of damage. You always want to move the transducer head. It evens out the intensity and decreases the risk of pain or irritation to an area. So while you're doing an ultrasound, if somebody complains of a deep ache or that it's too hot or that there's any pain, first you would try to turn the intensity down and move the head either faster or into a little bit more of a larger area. And if those symptoms go away, then you could possibly continue the ultrasound. Just continue to ask how their symptoms are, how they're feeling. But if they don't improve, then I would go ahead and stop the ultrasound. It may not be appropriate for that person. So one of the parameters is frequency, which is the number of compressions and compression refraction cycles. So compression rarefaction cycles. I said it wrong twice. Per unit of time. Frequency is the number of those cycles per unit of time. The lower frequency actually penetrates deeper. So 1 megahertz is a lower frequency. It goes deeper into the tissues than 3 megahertz. 3 megahertz is more shallow, but it has more of that thermal effect. So depending on what tissues you're over, the thickness of the tissue, and the desired effect that you're wanting, you would determine which of those frequencies would be best for your patient. The duty cycle is the portion of total treatment time that the ultrasound is being delivered. So in a continuous ultrasound, it's being delivered 100% of the treatment time. That it's continuously delivering that ultrasound. It has a thermal effect, which heats up the area, and that's one of the benefits, but it may not be what your desired reason for using it is. So if you don't want to a thermal effect, then you could use the pulsed ultrasound, and this alternates between on and off times. So if you're looking at a 20% pulsed ultrasound, then out of every 10 seconds, 2 of those seconds, milliseconds is what we're really looking at, the ultrasound is being delivered, and 8 of those milliseconds, it is off. It is just in like a rest period. And so it keeps alternating between those cycles. So the opposite would be true if we were on an 80% pulse, 8 of those milliseconds, it's being delivered, and 2 milliseconds, it's not. So this keeps you from having as much of a thermal effect, but still gives you the benefits of all the other benefits of the ultrasound. Okay, the non-thermal benefits. I was just checking to see if there was something else I wanted to say on that slide before I skipped over it. All right, some of the thermal effects. It's caused by absorption of sound waves that creates heat when you're using a continuous ultrasound. When the ultrasound hits that air-skin interface, the sound waves are reflected, and that increases the heat. It could be too high and cause pain or discomfort or even a burn. And so that's why we use ultrasound gel or some other medium like water to decrease overheating of that transducer head or of the skin right there, and because it decreases the reflection. Okay, so that's why it's so important to use ultrasound gel or water as a medium to decrease that reflection and the heat in that transducer head. Um, as things that affect and increase the temperature are the absorption coefficient and tissue type, the intensity, and the frequency that you set the parameters to. Bone also reflects rays, so that also causes an increase in heating around bones. So you have to be careful, especially in areas with little tissue covering the bones, like let's say an elbow or hand or a foot. You have to really be careful what intensity and frequency you set that ultrasound at to avoid overheating. You also always move the ultrasound head to avoid overheating. Another point I wanted to make was that refraction causes the rays to bend and spread to other areas. So even if you're just doing the ultrasound in a small area, the surrounding tissues are getting some of those waves and still having effects in some of the surrounding tissues. Higher temperatures are achieved in tissues with high collagen content, with higher ultrasound frequencies and higher intensity. So a 3 megahertz ultrasound produces a higher temperature than a 1 megahertz. And as the thermal effect increases, the depth of the sound waves actually decreases. So if you're wanting to go to have benefits all the way down through the layers of tissue and a deeper effect, you may want to use more of like a 1 megahertz, but you'll have less of a thermal effect. So to get more of a thermal effect, you want to use that 3 megahertz, but it won't go as deep into the tissue. So you kind of decide which effect that you need the most, what would be most beneficial to your patient to decide that frequency. To avoid hot spots, again, move the transducer head at a rate between 2 to 8 centimeters per second. Now, for me, when I do ultrasounds, I just do continuous, like little circles. So I do kind of circles around the area and just continuously go around little circles. Um, Kind of like what I would do if I was mixing cake batter. And you kind of go around the whole bowl and around the middle and around the whole bowl and around the middle so that you're getting the whole area versus just one area. That's what I do. I had a friend that I used to work with that would get to talking and would just go as fast as possible. I mean, she would just be moving that ultrasound head everywhere. And I mean, it was kind of crazy. The therapist that we worked with used to get on to her quite a bit because they felt like it was losing some of the benefits because she was moving it too fast. So there is such a thing of too fast or getting way out of the area. She would get distracted. And if she started out here, she'd be way over here doing an ultrasound. So you want to kind of stay in the area that you want to deliver the ultrasound waves. But I would go kind of around that area and just continuously move the head. So I just do little kind of slow circles in the area and make sure that I'm not staying over top of one place too long. Okay, I already said that one. All right, with the pulsed ultrasound, some of the non-thermal effects that we get, there is cavitation. So these are bubbles in the tissues that get larger and smaller due to the ultrasound compression and rarefaction. It is good because it helps the cell membrane become more permeable and allow more um, substances in and out of the cell membrane. And that is what called stable cavitation. So when the ultrasound is in a therapeutic range, which should be any of the settings you can choose on a ultrasound machine that we're using in the clinic, then those bubbles expand and contract and create a therapeutic effect of increasing the cell membrane permeability. If it were to be set at a parameter that was outside of that therapeutic range, which typically our machines don't allow you to do that, but if they did, then it could cause unstable cavitation, which means that the bubbles actually just get bigger and bigger until they implode and they release and cause the formation of free radicals, which can actually damage the cell membrane versus just making it more permeable. So that would be an effect you would not want, but that's not an effect we're typically getting in the ranges we use. So cavitation is a beneficial effect that helps increase the permeability of the cell membrane. Microstreaming, this causes a circular flow of materials around those bubbles. And then acoustic streaming is basically a larger flow, and it can increase tissue circulation, which you want to promote tissue healing. Combined, all three of these, the cavitation, the microstreaming, and the acoustic streaming, increase the cell membrane permeability. They increase the intracellular calcium that's available, and then they promote cell function and tissue healing. Typically, the most commonly used parameters for a pulsed ultrasound is 20% at 0.5 watts per centimeter squared for those non-thermal effects. Okay, I've already talked about that, so I don't need to talk about any of those. Some of the indications. So if somebody has tightness or shortening of the tissues or pain, then you might want to use a continuous ultrasound. When you use continuous, you still get all the non-thermal effects as well, but do remember that the thermal effects are also there. For a pulsed ultrasound, some of the indications, if they have a wound that's not healing, like a pressure sore, a dermal ulcer, or after they've had a surgery and you're trying to promote healing of that wound, then you could do a pulsed ultrasound. In tendons and ligament injuries, you could do pulsed or continuous, depending. So one example of when you would use a pulsed ultrasound in a tendon injury or issue is if they had acute tendinitis, like because of the inflammation, you don't want to use continuous because you could cause more inflammation. Versus in chronic tendinitis, you could use continuous because that thermal effect could help also increase the extensibility of that tissue, maybe help heal some of that scar tissue that's formed or anything like that. Fractures, there's been a lot of back and forth research. Initially, there was kind of a precaution of using ultrasound over fractures because they felt that it could delay the healing. But most of the research that's been released in the past 30 years or more has actually indicated that it helps, especially at a pulsed ultrasound with lower parameters like lower intensity and frequency, can help a non-union or a non-healing fracture heal more quickly. And they've even made these units. They're called, it's what we see in that picture. They are called LIPUS units, which stands for low intensity pulsed ultrasound. That sometimes a doctor will prescribe in order to help that area heal over a fracture. And the intensity is typically 0.15 watts per centimeter squared for 20% pulsed, and a little bit longer duration, so 15 to 20 minutes used every day. But some of those machines may even be set to an hour or 2 hours at that low intensity and 20% pulsed. Okay, and then phonophoresis, while I have this already here, I'll just go ahead and talk about it. That is when you apply ultrasound over a topical drug in order to increase the delivery of that drug into the area. So maybe you have an anti-inflammatory cream or something like that that you rub over the area and do the ultrasound over that to help deliver that drug deeper into the tissues, to increase the absorption of that. And then you can also use it over carpal tunnel. There's also a little bit of mixed research on that and mixed feelings on that based on clinicians. But that is one indication for pulsed ultrasound. Some of the contraindications and precautions. So contraindications, if there is cancer, pregnancy, typically that's a contraindication for all of our modalities. We don't do an ultrasound directly over central nervous system tissue, so we don't do it on the brain or directly over the spinal cord. If there is cement holding a joint together, like there has been a joint replacement, we don't do it over that area or over areas that have plastic or metal. Remember, metal heats up faster and could cause some type of a burn. Plastic could possibly melt with the thermal effects. It could damage it. With thrombophlebitis, that is a blood clot that's causing swelling in an area. You don't want to ultrasound over a blood clot because it could make the blood clot break up or get smaller, and then it could travel and cause more damage somewhere else. We don't do ultrasounds over eyes or reproductive organs. And then our precautions are just acute inflammation. You could do a pulsed ultrasound, but probably not a continuous. Epiphyseal plates, those are the growth plates, and we just really don't know what an ultrasound does to a growth plate. So we just be very cautious over ultrasounding over that area. Maybe if you had a knee of a young athlete and wanted to do an ultrasound over their patellar tendon or something like that, then you would definitely want to do like 3 megahertz and pulsed so that it's not traveling as deep or affecting that growth plate if it were to have a negative effect. Or you may just do a different area if their diagnosis calls for it that's not directly over a growth plate. Fractures, again, could be they could benefit or they could slow the healing of fractures. And then breast implants, the thought is that increasing the temperature of the contents of a breast implant could cause it to expand and eventually rupture. I don't know if you hear that noise in the background. I'm sorry. One of my kids has this like dinosaur watch that he set a timer on and it's going off in the background. So I'm really sorry. That's why I'm getting distracted. Okay, so some of the adverse effects of an ultrasound, it could cause a burn. That's one of the main reasons we're constantly moving that sound head to minimize the chances of it causing a burn so that the waves are kind of evened out and dispersed more evenly along the area. Some of those standing waves, especially if you just sat and held an ultrasound head still over an area, it could cause standing waves that can cause damage to the lining of blood vessels and could cause them to rupture. If you're moving the transducer head continuously or the ultrasound head continuously, it should not do that. And so another reason to constantly move it. And then there could be some cross-contamination or infection. There was a study done that basically showed that when they swabbed the ultrasound head and the gel, and especially the tips of the gel bottles, that they found some bacteria in those areas. So one of the ways we avoid that is we typically always clean the ultrasound head and ideally the tip of the gel bottle with an alcohol swab before we apply it to the patient. You also want to be very cautious when you are applying ultrasound over some type of open wound, that you're using a very clean technique and not cross-contaminating or causing some type of infection. Although ultrasounds are typically indicated for healing of a wound, so you just want to be a little bit cautious with that. The application technique is somewhat similar to what we've talked about with heat and ice. You first evaluate the patient and determine if it's safe to do an ultrasound. The next three are a little bit more varied in what order. First, it says apply the ultrasound gel, then select the sound head, and then set the parameters. Typically, I would select the sound head first because I don't want the gel just sitting on I've put the gel on the patient before and it just like slides off their arm. So I typically choose the sound head first and set the parameters, and then I put the gel on the sound head and then touch the sound head to the patient at the area that I'm going to start doing the ultrasound before you ever turn the machine on. If you turn the machine on and the sound head is not in contact with the skin and or does not have the gel on it, you could actually damage the crystal. It could overheat because of the transducer head touching air and causing some of that reflection back into it. It could damage the crystal, and you could have to replace the sound head, which can be expensive. So always put the gel on and touch the patient in the area that you're going to do the treatment before you turn the machine on. Always, always, always. That will be an automatic fail of a practical if you have an ultrasound head just hanging out in the air and you turn the machine on. Always move the sound head. Move it slowly and continuously throughout the treatment, and then you document. We'll talk about what you document in a minute. So again, just to kind of recap what we've talked about, the frequency that you determine on an ultrasound, you determine it based on the depth of the tissue, with 1 megahertz going deeper into the tissue and 3 megahertz being more for shallow tissue, but also having more of a thermal effect. With the duty cycle, you determine, do you want the thermal or non-thermal? If you want thermal, then it needs to be 100% or continuous ultrasound. For the non-thermal effects, if you don't want thermal, you still have the non-thermal effects with thermal, but if you don't want thermal, then you do a pulsed ultrasound. Typically, it's between 20 and 80% pulsed, and typically the machines have preset buttons that you choose rather than typing that in. The intensity is typically anywhere from 0 to 3 watts per centimeter squared. When you are using 1 megahertz, we are typically at between 1.5 and 2 watts per centimeter squared, versus if you are using 3 megahertz, we typically are around 0.5 watts per centimeter squared, or sometimes even less. The duration, the amount of time that you do it, typically we'd go between 5 and 10 minutes. But you want to look at the area, the treatment area, and that can determine how much time you spend. So if you're doing ultrasound on a quad, you may spend longer than if you're doing ultrasound on a hand. Typically between 5 to 10 minutes is what we use. And in all honesty, I typically use 8 minutes. A lot of clinicians do that because of the Medicare billing rule of 8 minutes, where you must do a treatment for at least 8 minutes before you can bill for a unit. If you do like 7 minutes, but it takes you a few minutes to set it up and clean it up, then you still spend 8 minutes on that treatment. But being that 8 minutes is right in the middle of that 5 to 10 minute range, that's what I find most people do. I will do longer if it's a bigger area or really thick tissue or something that I want it to penetrate a little bit deeper. You look at the area to be treated, the number and frequency of treatments, and the sequence of treatment, whether you do it like at the beginning or at the end, and that determines when and how you do the ultrasound. So frequency, typically 1 or 3 megahertz. Duty cycle, either 100% for the thermal effect or between 20 and 80% for non-thermal. Intensity, between 0 and 3 watts per centimeter squared, with the typical range being 1.5 to 2 watts per centimeter squared when you're using 1 megahertz, or 0.5 and below if you're using 3 megahertz. And then the duration, typically between 5 and 10 minutes. You do need to know that and be able to do that and set it up for a patient scenario. Documentation, just like all the other modalities, you want to document the area treated, the treatment time, the position of the patient, and then specifically with ultrasound, the frequency, intensity, and duty cycle, and what medium you use. Now, if you pretty much use gel every time, and so does everybody else in the treatment, you don't have to document that every time. I would just document if you change it, like if one time you use water instead. And by water, we don't just like squirt water on the skin and use that instead of gel. It would be like their hand is dipped in the water, and so is the ultrasound head. And it can be, the sound waves can be transmitted through the water that way. So usually that's for more like a hand or a foot that will use water and they're submerged in that water, versus we don't just like spray the skin with water and use that. We would use gel if they're not submerged in water. And then you want to document the patient's response to the intervention, so that you can determine how to move forward. If it was good and they didn't have any bad effects, or if they said it was too hot and you had to turn the intensity down or anything like that, always document. All right, I will see you in the next lecture.